to Breakfast with Spaniels with Dr. Judy Morgan.
Susan Roop, first on board. Morning, sweater. It's Friday, and thankfully Elsa is out of here. It rained buckets and boatloads yesterday. Oh my lord. Yeah, you guys up north have it now, Terry. Yeah. We got some standing water. So I'm happy I don't have a basement anymore.
Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
5 a.m. in California. Yes, it is. Congratulations, those of you who get up that early. Although sometimes we do. So I was looking at my my inbox this morning, and I get this thing from Pets Plus magazine, and it says pet ear infection treatment market to exceed $877 million by 2028. Because the market is expected to expand at a compound annual growth rate of 6.56% from 2021 to 2028. The increasing prevalence of ear infections in companion animals is one of the factors responsible for the market growth. Increasing ear infections. Okay, so what's the driver behind increasing ear infections? By the way, otitis externa, or external ear infections in the canal where you can see it, are the number 2 reason why pets are dogs in particular, are presented to veterinarians for treatment. Why do we have so many ear infections? We have spaniels. They have long floppy ears. Spaniels in the past have been known for having a lot of ear infections. I grew up with a Cocker Spaniel. When we adopted Scout and Freckles, they came with horrendous ear infections. Why? And why do our dogs not get ear infections? The only ear infections I've ever had in our Cavaliers are when I've gotten a boatload of water into their ears doing a bath, not being careful about how I'm doing it. That's my own fault. And Teresa already posted, it's poor diet. And this goes along with what I talked about 2 days ago. We're coming out with this new vegetable matter-based dog food, like it's a good thing, and grain-based foods. And then we're wondering, do you see a connection here? The pet food companies are feeding our pets crap that causes more skin infections, more allergies, more ear infections, feeds right into the veterinary profession. Why are pet food companies, well, actually, candy companies, who are buying up pet food companies and also buying up veterinary companies and veterinary corporations, why do they all go together? Let's see, one feeding into the other. Let's see, if we continue this chronic cycle of giving our pets more ear infections, more skin allergies, more inflammation, we keep feeding into our veterinary field. Oh yeah, then we feed into the pharmaceutical industry, which is like, here, let us develop some really toxic chemicals to treat these animals with. Ooh, Apoquel? Cytopoint? Steroids? Yes, let's just keep feeding into that part of the industry as well. Yes, this is a multi-billion-dollar conglomeration that feeds into itself. And what's really interesting is, of all the consultations I get. Yeah, Nicole, I don't remember the last time I had a cocker with an ear infection. Yeah, because you feed them correctly. Of all the consultations I get, now if ear infections are the number two problem, number two reason why dogs are presented to veterinarians for treatment, how come I never do consultations on chronic ear infections? I've done one where a person did a consultation with me because her, I think it was a lab, was having chronic ear infections. Well, the dog was on a kibble-based diet, which means tons of starchy carbs feeding into that. The dog had never had a culture on the ears, so Lord knows what bacteria was growing in there. And do you know what happens when you just randomly choose an antibiotic and throw it in there and then it doesn't go away? So you choose another random antibiotic and throw it in there and it doesn't go away, and you choose another random antibiotic and throw it in there. Guess what? You go through all of them, and now you've got incredible resistance. And that's what happened with our Scout, because his had never been treated and his eardrums ruptured. So the external infection became an internal infection. Then it required treatment internally as well as externally. And by the way, I see so many of these ear infections treated improperly. If the eardrum is intact and all you have is an external canal infection, oral antibiotics are not going to do squat for that. Oral antibiotics don't get into the external ear canal, they get to the internal. So you only need antibiotics orally if you have an inner ear infection, which means that the eardrum has been compromised. And not enough veterinarians actually pick up the otoscope, look down in there, and see whether the eardrum is intact. Sometimes you can't see it because there's so much goo in there. Okay, great. Let's clean out the ear. Let's get a culture. Let's get a cytology. Let's find out, do we have yeast? Do we have bacteria? Do we have a combination? Almost all of the ear medications, the veterinary ear products, are combination products that have a very strong antibiotic, a steroid, and an antifungal. It's very hard to find a product that is just a steroid, just an antibiotic, or just an antifungal, because half the time a diagnosis is not made. It's just lift up the ear flap. Oh, there's goop there. Here, take one of these combination products. It'll kill everything, so we don't have to figure out what actually is going on. What you really need to do, yes, culture. Find out really what's going on. Get a cytology. Find out, do you even need to treat for a bacterial problem? And if you do have bacteria there, then get a culture and find out what bacteria it is. That way, you are going to choose the appropriate antibiotic that will solve the problem on the first round. Is there a high ratio of dogs without an eardrum, or does that happen to an eardrum bursting to an infection? Most of them, it's we're getting rupture because of chronic infection or improper cleaning. So we get people who are really overzealous with the flushing of the ear canal. And so I don't have dogs with ear infections, but I did a video, I don't know if I can go back and find it, a couple years ago on actually how to clean a dog's ear. And I showed how to put the stuff in there, massage the base of the ear, let them shake it out, and then just wipe out what comes up. But we get an awful lot of people who are jamming things down in the ear, who are just using high pressure to squeeze things in there, and you can rupture the eardrum. So the thing is, if you have an animal, and this happens in cats as well. Cats don't get as many ear infections, but the ones that do get them, they get nasty ear infections. Cats will grow these beautiful black, purple polyps in their ears, which really have to be surgically removed, and they're from chronic irritation, chronic inflammation, chronic infection. I'll see if I can find that video. I think, you know how I find my videos? That we've got ear cleaners on the site for cats and dogs. But the way that I find my videos is I just go into my search engine and I put Dr. Judy Morgan cleaning ears or ear cleaning video, and it'll usually pop up. I like Zymox. Zymox is great. Can you be cleaning too much? Yeah, you can cause irritation with the cleaning. And frankly, I never clean our dog's ears. I don't have to. There's no debris in there. They don't smell. They're clean. They're beautiful. They're shiny. That's what you want. All right, your girlfriend's pup had an ear infection for months, brought him to AMC, did a full workup, and saw he has no eardrum, which you found odd. That would be very odd, and I would think that, yeah, your dog's ears are a mess, allergy related. So I would say in that dog where they saw no eardrum, probably it ruptured a long time ago, and it was such a big tear that it just shrunk back, and it just was unable to heal. So should ears be cleaned on a weekly basis? Again, I do not clean our dog's ears because they don't have any problems, and I'm not going to mess with success. If you have dogs who swim, dogs where you see debris, or cats where you see debris there, they're red, they're inflamed, then yes, you should try to put out the fire that's going on there. But if you're not seeing anything, they're not scratching. Now, our dogs scratch all the time. It's not because they have ear infections. It's because they have SM and CM. Echo ear, I have never seen. Don't know what that is. Only use kin and kind when she's itching the ear a lot. Ears are super sensitive, and they will be. And be very careful with what you're using. You don't want to use water-based products because then you're going to leave moisture in the ear. If you use an alcohol-based product, alcohol is drying, which is a good thing, but it's also extremely irritating. And if there is any ulceration, any little area of abraded skin down in there, and you put an alcohol-based product in there, they're going to scream, run away, and you're not going to touch their ears again. For years, Cocker Spaniels got a really bad reputation as being bitey, nasty dogs. You know what the problem was? They were running around with chronic ear infections and a lot of pain. And so when you went to pet their head, they were like, oh my God, don't touch me. Because they were painful. They got a bad rap. Our Cockers have always been really, really sweet. After pulling poodle ears, they tend to get an infection. Yeah, can you avoid pulling them? That's really irritating. So after pulling those poodle ears, I would put something like the Kin and Kind cleaner in there. I think we have the Project Suds cleaner as well, but you want to use something. The aloe that's in there is very soothing. Witch hazel is drying. You've got to put something soothing in there. You've got to put out that fire after you do that. Yeah, don't use alcohol-based. Don't use water-based. Your dog gets earwax on the outside. That alcohol will dissolve, but witch hazel will also dissolve it, and witch hazel does not burn, and it is drying. So is a small amount of wax in the ear okay to be left in if it's not bothering them? So let's see. Teresa Carpenter says, we use ear damp heat and Zymox for Joe. Even with the good diet, she grows a lot of yeast. Yeah, which means she's got some allergies to something else. And allergies are a common cause of ear infections. Oh, ear cocker was abused before we got him. The kid shoved pencils in his ears. It's amazing the things that kids will stick into any opening. Okay, yeah, you could wipe them out with coconut oil. That's a great thing to use in the ears as well. Very soothing. So, okay, all right. Maybe why she's rubbing her nose. Okay, I gotta go. I gotta go pick up corn, take care of animals, see how flooded we are at the farm. Last night there was some pretty good puddling going on. Q-tips, no. No Q-tips in the ears. Cotton balls to wipe out, or tissues to wipe out, something very soft and non-abrading. Be careful not to abrade that ear tissue because it's very, very sensitive area of the body. Very, very easy to abrade that area. Where were the parents? Yeah. Yeah, chronic ear infections until we discovered there was a chicken allergy. I am not a colloidal silver person, so I'm the wrong person to ask about colloidal silver. I'm just not a fan. Yep, bacteria and yeast. Just figure out which bacteria it is, treat it appropriately, and get it gone. Change the diet if you need to. Supporters I'll post, but we'll do tonight at 7. Not sure what we're doing. I think I should have Gwen arrange something, because she's really good at researching stuff.